And this is Aebhric O'Kelly, and he works for the Remote College of Medicine, which is on the other side of the world from us. And he does all sorts of interesting, like austere medicine, like trainings, along with kind of like the search and rescue side, if I'm correct.
That's correct.
And so we're really excited to have a different perspective entirely from what we know and do. In our group, we have a spectrum of people, from people who've like been active on search and rescue teams and active outdoorsmen their whole life, planning to go into a career, something like you have. And then we also have people who are more novice outdoorsmen and really just want to gain skills to take care of their family and friends in future pursuits of hiking and camping, and see how interested they get in it from there.
Good deal. Good deal. I can do a quick intro, and then maybe we can take some Q&As and we can discuss my passion for wilderness medicine.
Please.
Brilliant. So my name is Aebhric O'Kelly. My history is American Army Green Beret, and I then became a critical care paramedic. I moved to Europe, and I've been working for this nonprofit called the College Remote and Offshore Medicine. We're one of the largest providers for the fellowship credits for the Wilderness Medical Society outside the U.S. We focus on medicine for remote and austere, resource-poor environments. Most of the stuff we do is Africa and Asia. So we have had students come from all over. We had a nurse come from the South Pole station directly into our Trop Med station. Don't know how she got, interested in tropical medicine while she's in the South Pole, but a lot of what we do, a lot of the American docs and PAs and nurses are coming over for our tropical medicine, and they're doing the fellowship credit. And I thoroughly encourage you guys to look at the Wilderness Medical Society and gain that fellowship of the Academy of Wilderness Medicine. That I did that 4 or 5 years ago, and it really rounded out my medical training and made sure that I didn't focus on one aspect, that it caused me to focus on pediatric trauma, pediatric emergencies, or mountain medicine, and it just is a vast scale that you have to do to earn that fellowship, and it's definitely been an eye-opener for me. I'm heading to Tanzania on the 30th, so I'm doing my PhD down there, so my focus is the early assessment and management of the critical casualty on Mount Kilimanjaro, and not just expats. We're also looking at local nationals, and I'm there again in January, so I'm doing quite a bit with wilderness medicine in Tanzania, in Kilimanjaro, which is not a bad place to be.
That's really neat. So you started off as a Green Beret medic, correct?
That's correct.
And what skills did you take away from that, or what key things about that fueled your passion to continue doing that, after you got out of the service?
It was just one of those bugs that bit me. When I was in the service, I would spend weekends on my off time at the local emergency department, because it's just something I thoroughly enjoyed. So when I got out, it only made sense to continue on as a critical care paramedic, and then continue on with a doctoral PhD for medicine. Medicine bites everyone differently, and when I first started off, it was just a job. I really didn't look at it as a career, but something about, especially with the austere, the prolonged field care, there's a challenge there that you just don't see anywhere else. So I've worked in a hospital, in the States and Ireland and Africa, all over the place. And you guys know this, you have a wall full of kit, don't you? And you have a room full of experts, and it's brilliant. That is an amazing place to do medicine. But when you work in wilderness, when you go to Africa, when you go to Haiti, when you go to Central South America, and it's everything that you've learned and all the skills you have, and they're relying on you. You can't turn to consultants. So with wilderness medicine, you have to be the best, and it's a challenge. And I encourage you guys to find that bug, to better yourself. I think by learning wilderness medicine, you can bring that back into the hospital medicine, internists, or whatever your passion is, and it's going to make you a better doc, better PA, better nurse.
I heard you talk about a PhD in medicine is what you're pursuing now.
Critical care medicine, yeah.
Okay, is that stay at the paramedic level, or do we have something akin to that in like U.S. medicine? Do you know?
So, no, unfortunately not. And one benefit of coming to Europe is there's a lot more options for us. So as a master's degree paramedic, we have skills that are similar to a junior doctor, we call them here, would be like internist. What's the first thing you do after?
Like a resident or an
Like
intern?
a resident. And then you can continue on and get the PhD. The PhD is research, though. I don't get any extra skills above my master's level paramedic at the doctorate. It just means that I'm going to be doing research, and I'm going to have. So I work at this college where we're having research done as well. So it's important as a paramedic. Come on, there's loads of docs out there with PhDs. There's not many PAs and nurses and paramedics with PhDs. And I think it's a brilliant scale up for us to just challenge ourselves and be really good at research. And we're not trying to be doctors. That's just not, I didn't do that. I didn't want to go to med school. So it allows us as mid-level providers to be best at what we do.
That is really neat that you have that option, because I'm pretty sure in the United States, like the highest thing that you could ever classify a paramedic as is an associate's degree, which is like a step below a bachelor's degree.
That's right. Yeah.
And to go on from there, you'd have to do like a rapid transition course to nursing, which is like 2 years, or some of them go to PA school.
Yeah. If they're smart.
Yeah. Yeah. So, what are some of the different courses that you teach, or maybe what's your favorite one or two that you teach, and could you tell us about those?
Sure. So we've got a remote paramedic course running. That's a AS degree, 2-year AS degree, and that's fun. But the excitement I get is the tropical expedition medicine, because we have everyone from an EMT all the way up to these consultant anesthesiologists who think they're God, and they want to go work in Haiti or some other place, and they need to learn the basic skills of patient assessment, because these docs they're so used to saying, oh, we got an airway problem, and they stand there, stick their hand out, and they expect some magical device to show up. And we see them in our prolonged field care scenarios, and they're looking around like this, like, where's my nurse giving? I need some. So we need to teach them how to be good at the basics, as well as learning tropical medicine, expedition medicine, wilderness medicine. So our TTEMS course is kind of our flagship course, and we have vast amounts of North Americans coming through, including lots of PAs.
How long is that course?
It's 5 days. And it gives about 30 credits for the fellowship.
Okay. Are any of the courses that you teach, or like the 5-day-ish ones, are those things that PA students, like people in this group, could do?
Absolutely. We've had PA students come through. And if you're going to travel all the way to Malta or Kilimanjaro, depending on where you do it, you can do 2 weeks. You can do the advanced T10s or the basic T10s, advanced T10s together, and get probably around 50 points towards your fellowship. So yeah, if you're going to travel all the way to Malta, I mean, you can go diving and do all the other amazing things, but you might as well stick around for a fortnight and get some good training.
I absolutely agree with you, because we don't have an option for a wilderness medicine elective yet. We're only the second cohort of our program. So the first thing that we were trying to think about brainstorming starting up was in one of our 10-day total-ish breaks between semesters, or maybe immediately after graduation, just organizing a group of students to go do something together, not officially Yale affiliated, but
fair enough.
So we've been brainstorming about that.
We can definitely set you up in Malta. We can also we teach TTEMS at the base of Kilimanjaro, but what we do is we can come to your university and run a 2-week program. We do that all over the world. We just came back from Thailand, upcountry Thailand, running the same TTEMS program. So it might be easier to fly our staff to Yale to run the course, or if you have a wilderness somewhere in Vermont, there's more wilderness, we can run it there as well.
Oh, wow, that's really cool. I had no idea. So if you spend a lot of time in tropical medicine, I'm sure that the stuff that you take out into the field as like your must-have items are a lot different than what I've always taken out in high alpine
Yeah.
situations in the Colorado Rockies. What are some of your go-to items that you always want to have in the tropical scenario?
A microscope.
Like a pocket microscope? I need
Well,
to know more about this.
there's a couple options. We have something called a Narugo smartphone microscope, and it clicks onto the smartphone and gets you 400x. Now, 400x is not going to get you a malarial diagnosis, but you're going to see your helminths. You're going to be able to do CBC. You can't do a Chem 7, obviously, but you can do a rough, complete blood count, see if there's a shift, see where the white blood cells are doing. But for derm as well. So if you have, I mean, wilderness medicine is derm heavy, and we all suck at derm. I'm speaking for myself. We all suck at derm. So having the microscope on the smartphone allows you to kind of look in and see, and you can turn it into a woods lamp, so you can see if there's any type of fungus. Instead of using KOH, so we can also bring KOH to see if we can melt the fungus, and then we put that under the microscope. That is something that you probably didn't think about.
You're absolutely right. That's something I never would have even considered. And in the chat, Mary just posted a link to one she found on Amazon, and they're only $65. That's like cheaper than anything we've had to buy for PA school so far.
They're cheap as shit. And they're amazing. I mean, looking at bugs, they're looking. So in Tanzania, we look at we kill a mosquito in the dorm, and then we look at it. Is it a tiger mosquito? Is it Anopheles? So what kind of mosquitoes are flying? Do we need to worry about dengue? Do we need to worry about malaria? So looking at the bugs that you find is a pretty awesome. So that was one suggestion.
That is really cool. I never ever would have considered that. I'm thinking like, you know how we tell everyone to wear wool? Like I imagine that getting wet is a big problem in the tropical. I was expecting something like that. Definitely not a pocket microscope. Have you ever used like the other attachments for phones, like the ultrasound or the otoscope, or?
So one thing we do is we are pretty good at we call it austere clinical laboratory diagnosis, and it's part of we're researching all these new doodads that come out. So there's a lot of ECGs that are attached to phones, and so far we're not too impressed. The otoscope is good, but I'm a lazy medic. I'm not going to carry lots of extra stuff. So instead of an otoscope, we suggest you buy a USB camera or USB. It's a wire camera. It's a lot less weight. It's about that big, and it attaches to your USB, and you can use it for anything. But then you put just the what's the earpiece, the black earpiece that goes on the end of it. So you can do your ocular assessment. You can see the cone of light. You can do that, or if you're doing nair, seeing what kid put something up their nose, or so it's versatile and it's going to do more than one thing, and it's lightweight. So I wouldn't carry. Plus, it's €200-300 or US for these otoscope clippy things on. So why it's going to break as soon as you get it. So if you break this USB phone, the USB camera, it's like $10. So you just buy another one. So I haven't been sold on that. The ultrasound, absolutely. We're a big fan of the smartphone ultrasound. We have wireless ultrasounds that have a dual head, so it has convex as well as linear, so you can do all your EFAST as well as procedure, because having EFAST is really important. We don't see a lot of trauma in trop med, so having the linear to do IV sticks or do EJs or any type of, so we're pretentious a bit. If you're going to do any medical procedure, you need an ultrasound. And the new IQ butterflies are out now, and those are kind of the cutting edge. They're also smartphone.
That's stuff that I would have never even crossed my mind. I'm so glad you brought all of that up. That's really neat.
Yep, you've got to have an ultrasound.
Being someone who spent the majority of my life in the high alpine mountains in North America, one
Right.
thing that's like, I don't know if it's a valid fear or not of going on a tropical expedition is like trench foot and things like that.
Yes.
That's something that you see a lot with, or how do you prevent that, or is it as common
Those,
as I make it out to be?
so you have two pathways on that. It's a good question. The locals are going to have thongs, so they don't have to worry about. So they're going to climb Kilimanjaro as porters with thongs, or artivas maybe. So their feet are air out pretty nicely, so we don't have to worry about that. For expats, there's a big problem with that, and it's something I learned in the army, that you always have two sets of, of socks. You have a thin dress sock, really like almost, okay, don't tell anyone, but we wore nylons in the Green Berets. Not the whole, not, okay, just the short ones didn't go all the way up, but so you have your first sock needs to be really thin and tight, not tight, sorry, form fitting, because any tight sock you're going to lose circulation. And then a big woolly sock on the outside, and you're going to reduce your blisters. That, that saved me in selection, is wearing nylons, manly nylons. So it's going to be the same in tropical medicine areas. Your feet are going to sweat, and so what's going to happen is the sweat is going to go through the nylon and get absorbed by the thick socks, and it's going to keep your feet a bit drier. And then morning and night, you take both sets off, and you get a new set on, and then you wash them and hang them around your neck. So when you're climbing Kilimanjaro, they dry off in time for you to change your socks again. So nylons.
That's the magic answer. um, I totally lost my train of thought. I was so thrown off by the greatness of the nylon.
You'll never hear me acknowledge that, but yeah, nylons are awesome.
Andy, you didn't use nylons?
Some people did, but like a lot of them would just use those issued dress socks.
Yeah, the dress socks are awesome, aren't they?
Yeah, you issued dress socks with the green socks works perfectly well.
Yeah,
and
those work.
A lot of Coban, and then that squishy sort of bandage thing?
Moleskin.
Moleskin, yeah, moleskin on everything.
You make a donut out of moleskin, yeah. Yep. That's a good skill for you guys to learn.
Donuts out of moleskin.
And then I think my sergeant taught us like sterilize a for blisters, like put the needle and the thread through.
No.
It always seemed really dirty to me, but like,
yeah, so that's an open sore.
Yeah,
and
it just seemed like a bad idea, but that's what they taught us, that in the
bacteria
army.
in your feet and your socks. So let's open up a wound so you get infected. No.
I don't know.
So
we were just...
what we did was a little more drastic than that. So you would you take an 18 gauge needle, you'd inject into the bubble, and you would remove all of the fluid that's formed in there. You'd get some benzoin tincture, and you would inject the benzoin tincture inside the bubble and then collapse it. And so two things happen. One, it sterilizes, I mean, it sterilizes not sterilizes, it cleans that so there's no bacteria. It glues the roof of that blister back onto your foot, and then the searing pain of that alcohol is going to deaden the blister, so you can actually put your boot back on and your blister's gone because you popped it and you glued it back to your foot. And after the mind-numbing 10 out of 10 pain of having that benzoin tincture into your open blister, it goes away after a while, and then the pain's gone.
That seems like a better plan.
Yeah,
this was several years ago, though, so maybe they're not doing that.
What was the purpose of the thread? Why would you just
not know? He specifically threaded the needle.
I've heard people say that, and it's to keep the blister open so it bleeds. I don't know. That must be a Vietnam thing, so it doesn't make sense.
Apparently they were still teaching it till recently.
Nice. Yeah, don't do that. Any other questions?
Yes, anybody have some questions?
I've added the dates for the tropical travel and expedition medical skills course in the corner.
Nice.
Do those dates work with anyone here?
We've got one in April, followed by an advanced in April.
Oh.
Depends on what I can fit into.
Oh, the advanced isn't there yet. I'll have to email you the advanced. It's secret. We haven't officially launched it, but it's the week after the TTEMs.
Okay.
So you can let people know that. And it's college credit, so you can get some college credit for those courses if you want. Not that you guys need it because you're PAs.
So what's, aside from medicine, what's one or two personal items that you always like to ensure that you have on you when you're heading out?
Non-scented baby wipes. I can't emphasize the non-scented enough. If you're on a backpacking trip and somebody did bring the scented baby wipes, everyone knows it. It's pretty obvious. So the baby wipes are brilliant. It just keeps your feet clean, everything clean, and it's an old army trick, I think. Other personal items, I am a big fan of the largest thermarest blow up you possibly can. I think REI has a 3-inch now, 3-inch thermarest. So don't save money on the thermarest. The ones that I have, they're well over €100 and $100, and it's going to save your life. Especially now that I'm an old guy, you gotta have a nice, comfortable night of sleep.
What about a pillow?
So there's inflatable ones. I would put my backpack at my head, and I would use the waist. What would that be? A cushion or the belt of the backpack, and I would use that as a pillow to save weight. But nowadays, yeah, I would probably go ahead and get a nice inflatable pillow because you can inflate it part way and sit on it. So there's your dinner seating area, or it comes in if you need to. Well, you guys probably won't be fording rivers, but in the Army, we had to make sure that there's enough air in our backpacks to float. You only make that mistake once. So by having an inflatable pillow, you can definitely inflate that and make sure your backpack will float as you push it across the river. But that's probably not something you're going to be doing. And if you have to get wet in a river, that's a bad day at the office.
As someone who's definitely not local or even traveled to any of these tropical areas, you mentioned the locals walking around in just sandals. How do you feel about that for someone like me?
So Tivas are lots of expats wear Tivas in Kilimanjaro area. There's a lot of parts of Africa that you don't do that. You don't do that at all because there's worms in the grounds that, or if you get your feet, you'd love to. It's hot and you've been walking and you want to put your feet in the water. I know there's schistosomiasis that would love it if you dumped your feet in the water. So you have to do things a bit differently when you're in Central and South America or Africa. So Tivas are great to walk around camping because it gets your feet aired out a bit.
And do you have a favorite backcountry meal that you like to cook?
I'm a big fan. I said I'm a lazy medic, right? So if I don't have to carry a whole bunch of stuff, dried oatmeal, instant oatmeal has been, breakfast, lunch, and dinner sometimes. It's because it's lightweight. You can make it anywhere, and it's good bang for the buck in for calories. The other thing is, if you get rice, you bring rice, and you get a double Ziploc bag, and you get your rice in the morning as you break camp, and you get it full of water. You put it in a double lock, and you can set that right against your belly, right next to your, so the belt of your backpack is going to keep it from going anywhere, and you just let it soak all day. And so when supper time comes around, there you have your rice that's kind of pre-soaked and easy to warm up and should taste okay.
Yeah, that's really cool. I've never heard that one either. I like that. I always like to ask people that question because you get people who are like, oh yeah, dried oatmeal, it's light. But then you also have the people who like cannot just eat basic food, especially for 3 meals a day. So they're like, I've got my salt and I've got my pepper, and if I wrap a piece of pie up this way. So I'm always curious.
Yeah. So that there comes a time when blah oatmeal sucks. So drink some honey or something fun. Yeah.
Andy's asking how you feel about MREs.
I don't miss them. I think was it 3,000 calories a meal if I remember right. So in Ranger School we had 2 of those per day and we had to eat them all at once. So that's 6,000 calories in about 20 minutes. I don't miss that at all. But it's good bang for the buck. You have to strip them down, remove all the rubbish, and then keep the good stuff. The main meals, basically.
Yeah, take everything out of the packages. But I like the chili mac with the cheese.
Yeah.
Squeeze the cheese in there. That was the only one that I really loved.
Good stuff.
I do Tasty Bites. We got sponsored once in Nepal working after the disaster, after the earthquake there, and Tasty Bites sponsored us. And they're about the same weight as an MRE, and you can just rip open the package and it's all different flavors and not bad.
Tasty Bites. There's all sorts of MRE types. REI sells them, Mountain House or something like that. Yeah. Those are probably going to be better.
Tasty Bites are less constipating. You can review the Amazon link and you can see why.
Probably a pretty good option. Any other questions?
I guess my last question is I have two questions. The first one is, what do you think is one of the most basic skills that someone who likes to spend time out away from civilization is? So for our people who are trying to gain some basic skills to feel comfortable being able to take care of family and friends when they go on adventures.
So I think you need wilderness survival skills, and we've taught that as well. And I like cheating, so I don't expect you to go native, strip off all your clothes, rub yourself in mud, and make fire by rubbing 2 sticks together. That takes about 8 hours to if you don't have any tools or anything to make your bow drill fire by friction. I would really encourage people to go out and get a bit of a learning, even if it's a 1-day class, and then practice it. Go out into the woods around your university and make a 5-minute fire. So a 5-minute fire means that you get your tinder, you get your small pencil lead size sticks and then pencil size sticks, and you make a teepee and you get a fire. And once it's going within 5 minutes, you put it out because you're done. I mean, that's the hardest part. Once you have your 5-minute fire, you might as well be in your living room. So the challenge is learning how to do that 5-minute fire. And I would encourage a bit of training if you have someone around that area that can do wilderness medicine, wilderness survival. Getting fire, learning how to make a shelter out of a debris hut. A lot of non-sexy stuff is going to save a life. So what we, one of my docs is, sorry, this is really bad. One of my docs is lost in Malta trying to get into his hotel. I just left him, sorry, very rude, sorry. You leave docs by themselves, and they just, So wilderness survival, not only is it fun, but learning the 4 main skills is going to save a life. And if your car breaks down, and I lived in Alaska for a while, your car breaks down, you die. So everyone in Alaska has a boot full of survival stuff, blankets and flares and everything, so you don't die a horrible death by getting in difficult situations. So I think finding some good survival skills is fun. It gets you close to nature in a way no one else does. It's just stunning to be out under the stars in a shelter you made and a fire you made with, yes, you can bring the little kettle to have food and hot water, because it's all about, good cup of tea in the morning. But there is something pretty amazing about building all that yourself and knowing you have that reliance on you. So I encourage you guys to do the wilderness survival.
I like that a lot. What are you said the 4 main skills. What are the 4 main skills?
So there's shelter. Shelter is first. Shelter is by far the most important, not fire, or not food, unfortunately. So shelter, you can just pile a bunch of leaves and jump in them and crawl down underneath all those leaves. And that's what the animals do. If you look at what the animals do to survive, that's what you got to do. They don't walk around at 3 in the morning, freezing cold, bumping into trees. What they do is they make a big nest and they crawl into it. So so shelter is number 1. Fire, because with fire you can make food, you can purify water, and then water is next, and then food is the last bit. Because I know Gandhi went 60 days without food, but I don't. No, I don't want it. I like eating. So, but that's the last thing. I mean, you can go 3 days without food. You can go 3 hours without water. So those 2 are the last. Those, I mean, those aren't as important. Like in Alaska, you can go 3 minutes without shelter. You break down, or you suddenly you're in a camp, and then you go out to pee, and then you get turned around, and you don't know where anything is. You have 3 minutes to find shelter. That's it. You don't have much time at all. So shelter is by far the most important. Those 4 things are it. Lots of YouTube videos on those 4 things.
Thank you.
I see you guys also have online courses as well.
We have some medical courses. I think we have 6 or 8 now on online courses. You guys are welcome to take those. Some of them are good for the critical care board certification for paramedics. You guys as PAs can do those as well, or flight paramedic. I know you're not paramedics, but as PAs, you're allowed to take the board certification paramedic for flight paramedic through the Americans. It's called IBSC, International Board for Specialty Certification. I mean, they're the American guys that do all the flight paramedic certifications. You as PAs are well welcome to take that.
And then we also have a pretty large number of veterans in our program, both in the 1st and 2nd cohort.
Yep.
Do you have any, and a lot of them, you know, were medics and things like that. Do you have any tips for them about how to make that like medical transition from like medical to civilian medical career world? Was there anything different about that process?
It took me a while, I'll be honest. I think for me, I got out in the Army and I had nothing. They're like, oh great, you have no medical training, go to EMT school. So no ego, no problem. I went to EMT school and I started working as a EMT. And that's, I don't know, just being on an ambulance and dealing with civilian population is such an eye-opener, because it's all drunks, old people, and kids. So what do we see in the Army? Okay, we see drunks. Yeah, we do. But we don't see old people, we don't see kids. So it was a learning experience for me, even at the EMT level. So I would say, don't have an ego. I know you're a 68 Whiskey and you're amazing combat medical technician, and you've done all this stuff. You can do surgical airways and needle decompressions and chest drains, blood transfusions. Yes, that's great. But don't come into the civilian world thinking you're God's greatest gift. You are, of course, but you can't think that. You've got to start at the bottom and work up again. And that's why a lot of the 68 Whiskeys are getting out, going to PA school, because it's a much better fit than nursing. I'm kind of biased, sorry. I don't know, is there any nurses here? Sorry. But, nothing personal. Nurses are great.
She's becoming a PA, it's fine. She gets
Okay.
it. And then do you just have any other, because you're doing exactly the things that a lot of us want to do. Do you have like any good tip on how to get into that? Typically, it seems like most people have told us that it's just networking. Would you agree with that, or do you have something different?
It is. I'll agree with that. But I also believe that you make your own reality. So if you want to get into this, get your fellowship at the Academy of Wilderness Medicine. Go to a WMS conference. Go to the SOMA conference, the Special Operations Medical Association. I know it's for SF medics, but there's vast amounts of civilians, vast amounts of PAs, vast amounts of non-SF guys. It's in Raleigh-Durham in May this year. The vast amounts of learning you get there about medicine in crappy places. Same with the Wilderness Medical Society's conference. And in the WMS, you'll network with other PAs, with other NPs, and see what they're doing a ski patrol. And then you can talk to someone and say, hey, I saw your lecture on ski patrol. How do I get into that? Oh, you should talk to my friend that's just happens to be Connecticut. Oh, really? Well, I can. So that, yes, it is networking, but you have to start the fire somewhere. You have to bring the passion. You got to have the passion within the fire within the belly yourself. You got to bring that in. You can't expect to go to a conference or get your qualification and get on, for me, getting on the ambulance and expecting the world to come to you. You have to find that passion within you for this amazing way of doing medicine.
Does anybody else have any questions? Do you have any questions for us?
So I understand you guys are doing the PA program. Is that 2 years? Is that right? And it's a master's program?
It is. Yeah, and our PA program is really the first of its kind because it's called Yale PA Online. We have an on-campus program as well. So, but we're like a hybrid online program. So we're all over the U.S. from Hawaii all the way to Maine. And wow. Yeah, Jackie's saying it's 28 months. So 2 years, 2 full years year round, 3 semesters a year plus 1 semester.
Okay, good deal. Good deal. A nice part of the world to be in, especially in the autumn colors. Oh, okay, you guys aren't in Connecticut. Sorry, you guys are all over.
We're all over. Jackie's in Connecticut.
I'm in Phoenix.
And
I'm in Miami.
And Miami. Good fall colors. No, I guess no fall colors. Are there fall colors? Not at all.
Fall colors. We know it's fall when the license plates start to change colors.
Fair enough.
Same here.
Good.
Good stuff. Well, I'm impressed with you guys. I think the PA program is where the future is. There's so many shortages for docs that, especially here in Europe, and I'm sure it's the same in the U.S. The PA program here in the EU is starting to kick up, and you are the future for emergency medicine, for family practice. That is you guys. So I encourage you guys to be the best you can for your patients.
Thank you. It's funny you say that because Mary and I were like, and all of us were talking about that while we were waiting for you. She was talking about that exact same thing in her international experiences and how she's seen the same thing.
Yes, absolutely. So I'm attending the meeting in Istanbul about healthcare work accreditation and workforce. And really, truly, the only way is, in my mind, is the belief that physician assistants are the ones who are going to be able to supply that care around the world. Because our education is quick, it's rapid, and we're readily able to be deployed to different areas. So I think we can do it for the UN goals for 2030, which are to have healthcare everywhere, and that is the goal. So
good.
It's exciting.
There are PAs in Tanzania, but they're called clinical officers, but they are doing the same thing. In fact, in Tanzania, there are more appendectomies done by clinical medical officers than doctors.
Yes.
Surgery doing really well in East Africa.
Yes, I'm a liaison and honorary board member of the Global Association of Clinical Officers and Clinical Associates in Africa, and on the board of PAs for Global Health. And so I am inputting them one by one into our PAs for Global Health website, so that the PAs and clinical officers, clinical associates can feel a sense of community and join the PAs for Global Health website, so they can have access to CMEs and learn and meet people from around the world. So Africa and India and Malaysia and Papua New Guinea are the ones being entered in for free right now.
That's the future.
Yes.
Good. Well, unfortunately, that's all the time that we have because a bunch of us have to leave to go to class now. But thank you so much for
my class.
Yeah, your class, taking your hectic schedule and still making it work for us. I hugely appreciate it.
Good luck with your career, and send an email to me if you have any questions.
Thank you so much for meeting with us.
Have a good night.
Thank
Yep.
you.
Bye.
Yep.
And